Good morning or good evening, everyone. Thank you very much for joining us for this session of this webinar of the Asian Impact webinar. My name is Silvia Mandico. I'm an economist at the research department at ADB, and it's my pleasure to be hosting today's session on mapping Asia's unpaid care economy, challenges, and policy pathways. So as aging populations in Asia raise critical care challenges, this webinar will examine care patterns, gender roles, and future needs with insights to inform policies addressing gaps in old age care. For today's event, we are going to have a presentation by Gretchen Donehower, academic specialist and researcher at the Center for the Economics and Demography of Aging, followed by a panel with specialists. Gretchen, please, the floor is yours.
Thank you very much. Thank you for the invitation, excuse me, and thank you participants out there for your kind attention. Let me start my slides. So this work comes out of two linked projects. You can see our logos down there in the bottom right-hand corner. NTA stands for the National Transfer Accounts Project. And that is an estimation project that's in around over 100 countries at this point around the world to take our national accounts, which are aggregates for countries, and pull them apart by age so we can understand the age dimension of our economies. Imagine sort of a 2D map that becomes three-dimensional when we add the elevation. So this is taking our single numbers for GDP, for total consumption, et cetera, and sort of pulling that apart by age so we can see the age dimension of our economies. Counting Women's work is also, that's the other logo down there, also about understanding the age dimension of our economy, but it's to add a part of the economy that is not covered in national accounts, and that's unpaid care work. And I'll get more into the definition of what I mean when I say unpaid care work in a moment. So this work is motivated by the question of, is aging Asia Pacific facing a shortage of care workers, care work in the future? And if we want to ask this question, what kinds of data can we look at to evaluate the situation? And so that has two parts. First is mapping the care economy, is looking at the age dimension, because age is such an important part of the care economy. We need care more when we're young and when we're old than when we're adults. So we can map the care economy by age, and then we can use population projections to look into the future and see if this care economy is going to be sustainable in the future of population change. So to define care work and the measurements or the tools that we can use, care work, it's easier to define if we separate it out into two buckets. I use the terms direct versus indirect. Direct care is care for community or persons, including children, sick or disabled adults, or frail elders. And the United Nations has gotten involved in care work and trying to develop frameworks and measurement tools and nomenclature to understand the care economy. And their sort of official term for this direct care work is caregiving services. And then there's what I call indirect care, but the UN refers to this as domestic services. So this is care work provided through housework and other household activities. So think of sort of cooking, cleaning, household maintenance and management, et cetera. And then we can also look at the care economy on whether it's paid versus unpaid. So there are paid and unpaid providers of caregiving services. There are paid and unpaid providers of domestic services. This talk is going to focus exclusively for the rest of the time on the unpaid care economy, but we're also pursuing projects that are trying to bring those parts of the care economy together so we can understand them more holistically. And for the measurement piece, unpaid care work, we in this project are using time use surveys to get at that. So many countries have national level time use surveys that ask people what they're doing at different times and code those into a certain group of activities, many of which are direct or indirect care. So we can look at how much time is being produced by people of different ages in these different care activities. Okay, so that's some preliminaries. Now, the rest of the pictures, mostly I'm going to show you, are what we call in the project age profiles. So these are cross-sectional estimates from one, so they represent an annual estimate for a country, and by age, and this is in hours per week. And there are two types of data on each one of these charts for 7 Asian countries, although we do have many estimates outside of Asia as well as part of the project. So the solid lines are the average amount of time people are spending by age in these different countries for a relatively recent time use survey that is available in unpaid care work. And then the dashed lines is market work. So market work is the one we usually think of as work, and is sort of represented in national accounts as contributing to measures like GDP. And the biggest takeaway from this picture is that unpaid care work is a large part of our total working lives. We spend a lot of our sort of productive energies taking care of households, raising children, caring for elders, and it's definitely comparable to the amount of time that we spend sort of doing market production. The other thing to notice on here is that for many countries, India, Mongolia, well, pretty much everybody except for Bangladesh, at the oldest ages, there's more time being spent in unpaid care work than there is in market work. So it's much easier to sort of retire from a market job, these estimates are sort of indicating, than it is to retire from sort of taking care of your household and caring for other persons. So this unpaid care work also has a heavily gendered pattern to it. So this picture, this set of charts for the same 7 countries, is taking that dashed black line that I just showed you and pulling it apart for men and women, and also the solid lines. So what we see here, and what we see in every country that we've done these estimates in, is that women are specializing in unpaid care work. So that solid red line is substantially above the solid blue line. So women are specializing in unpaid care work compared to men, and men are specializing in market work compared to women. So the dashed blue line is significantly above the dashed red line. The other thing to notice here is that there's a great deal of variation across these countries in sort of how heavily segregated economic life is by gender in these places. So Bangladesh and India, there's a very large distance between what men and women are specializing in. Mongolia, Thailand, it's a little closer. So while it seems fairly universal that men are specializing in market work and women are specializing in unpaid care work, there's a great deal of variation across countries in the degree of specialization. And this picture also does a good job at showing that everyone is doing every kind of work on average, but there's just differences across genders in those average levels. So unpaid care work is produced and consumed by different age and sex groups. So in our project, compared to a lot of unpaid care work research that is exclusively looking at the production, we also estimate the consumption of this unpaid care work time. So who is receiving the care that's being produced? And we don't observe that directly. Instead, we have indirect methods to make an estimate, sort of a guess about who's consuming this time. So for the indirect care, the domestic services, we assume that everyone in the household shares equally, consumes equally. So for example, if I spent an hour cooking for my family of 4 persons, we would each consume 15 minutes of that time, and I would have transferred 45 minutes of that time to other persons in my household. For the direct care measure, that's not a good model, and so for those estimates, we use numerical methods to look at how much care time, direct care time, is being produced in households by different types, and compare that to household structure by age and sex. And that allows us to sort of impute who is consuming this type of care in the household. So what you're looking at here in the blue line is those same production profiles I've been showing you, but now we can add a green line, which is consumption profiles. And then the difference is transfers. So there's no because the production and consumption is sort of a simultaneous transfer, there's no, you can't save up unpaid care work time, we assume, to consume later. You're sort of directly receiving the care at a point in time. So those purple lines, those purple dashed lines, what to notice here is that they are highest in every country in this sample for Asia, but also in every other country that we've looked at for children, for infants. So what that means is that the net consumers of unpaid care work, the greatest net consumers of unpaid care work, are children. Then look at those purple dashed lines at the oldest age groups, and what you'll see is it's relatively close to that 0 line. So in the working ages, that purple line goes negative. That means those age groups are making net care transfers to other age groups. And at the very oldest ages, we would expect those lines to maybe go very strongly, very sharply up above 0. But they really don't. They just barely cross over to 0. And for example, in Korea, it looks like it's just about 0 at that oldest age, sort of the same thing in Thailand. So that means that compared to children, older persons are net consumers of, or net receivers of transfers to a much less degree. So this is sort of a first path at addressing this question of, are older persons really consuming a ton of this care work? So on net, if we count the fact that they're also producers of this care, we do not see evidence for that. We'll talk a little more about that in a minute. Okay, so there's also a heavily gendered aspect to this, as I mentioned earlier. Unpaid care work is produced and consumed by different age and sex groups. So in this group of graphs, I take that purple dashed line in the previous slide and separate it out for men and women. So what this graph shows you is that with the exception of men in their sort of 20 and 30s and 20 to 30s in Vietnam, men are always net receivers of time unpaid care work transfers at every age. And women at every adult age pretty much are making those net transfers to other age and sex groups. And again, this is on net. So everyone is making transfers to everyone else in their households, but on a net basis, the production minus the consumption, women are really the net providers of this kind of work in these economies and pretty much every other one that we've looked at. So we can also look at this unpaid care work consumption in a few different buckets. So this shows the black line is the average consumption of housework, that indirect care work, cooking, cleaning, household maintenance and management, et cetera. So what we see, and the blue line is the consumption of childcare. Makes sense that would be just in those child ages. Now, the red line for adult care, we would expect that, or rather my sort of prior was that would be sharply upwards at the oldest ages, but we really don't see much evidence of that. And then there's supposed to be a green line for community care, but at a population average, that's such a rare activity that it's almost 0 compared to the other types of unpaid care work consumption, because we're sort of assuming it's shared equally across the population. So this is things like volunteering, through community groups or religious groups, etc. So again, what to take from this is that children are large consumers of those direct care transfers, older persons, not so much. Now, why might this be? Part of this is certainly data driven, because we know that some of the largest sort of care transfer times come at, say, when an elder has a health crisis or something like that. And those are certainly going to be times when you're very unlikely to answer a time use survey or be, a respondent to a time use survey. So we're sort of missing out on those brief periods of very intense care transfer. And it's also possible that for many elder care transfers, that people are sort of coding those as social interactions, leisure interactions, when really there's a great deal of care activity that could be going on, like monitoring an elder's health, helping them with other activities, but it might be coded by respondents as being social time. We have looked at other surveys in the health and retirement studies sort of family. And even in those surveys where they're designed to really try to answer these questions more accurately, we actually even there still don't find a huge amount at a population average level of consumption of net consumption of care by older persons. Okay, so that was sort of a first pass at the map of the care economy. Now we want to ask, what is this? How might this care economy respond to the population changes that we know are coming in the near future? So looking at the future of unpaid care work, we can use care support ratios. Care support ratios take our snapshot of current age profiles of production and consumption, so all those lines I was just showing you, and then weight them by UN population projections for each year to create an unpaid care support ratio. So on the top, we do this sort of projected, simulated aggregate production of care in time units. And then in the denominator, we have this projected aggregate consumption of care. And so the ratio together gives you an indicator of how population change may impact the unpaid care economy. So if that care support ratio is rising over time, that means that given the current age arrangements of my care economy, population change is going to make it easier to supply that care. There'll be more of it than I need if current care demands continue into the future. If that support ratio is falling, then it's going to be harder to supply that care over time. The age structure will change such that it does not favor the production of this care relative to what we think the demand might be. Some caveats here. This is an indicator only. In practice, unpaid care work production and consumption must adjust to match because the care is consumed and produced at the same time. So we know that in practice, the support ratio has to be 1 every time, but this is just sort of an indicator of whether my population age structure change will make it harder or easier to sustain that. Also, this indicator I don't mean it to imply that the current unpaid care work production and consumption is optimal in any way. There may be distinct shortages of care right now, or there may be care that's being supplied, maybe that's sort of in an inefficiently allocated. There's nothing optimal about today's care economy map. It's just trying to say whether what we're doing now is going to have to change radically or whether we can sort of keep doing what we're doing today. So these are probably familiar pictures to many of you who work in Asia. So this is just a picture of what that future age distribution is going to look like. So this is the latest United Nations population projections, medium variant, and the lines show the proportion expected for each age group. So the red line is for 2025, the blue line is for 50 years in the future, 2075. So for every one of those countries, we expect that at the oldest ages, that blue line is going to increase, that share is going to increase quite a bit. And at youngest ages, the blue line is going to decrease. Now, for infants in Korea and Thailand, we actually see those 2025 and 2075 shares being quite close, but that's really a sort of a product of fairly strong fertility sort of recovery assumptions that are built into these projections. But they do contain the projection of pretty rapid increases in the shares at oldest ages. And that's something that sort of those folks are already alive. So we have a pretty good guess on sort of barring any large mortality shock that, you know, those population shares are going to be there in the future. Okay, so here are my care support ratios for 6 different sort of types of care. The top left panel A is unpaid care work altogether. So for my sample of 7 countries, it looks like for Mongolia and Bangladesh, there's a slight increase from 2025 to 2075. And these are sort of set at 1 at 2025, so we can focus on the relative change over those 50 years. So that means for those 2 countries, it's going to be relatively easy for them to sort of keep the overall care patterns that they have today. For Republic of Korea, that's the black line, Thailand in the green, it's going to be a little tougher. But still, there's not a huge difference in the relative sort of changes in those ratios across countries. If we look at just housework, that's even less of an issue for population age structure impacting that care economy. Those lines are fairly squashed close to 1. And that's because the consumption profiles are also fairly flat across the age range. There isn't a huge variation in consuming housework. The total care is a different story. There's a pretty decent spread, and that's because we can look at those 3 types of care I was focused on earlier in the second row: child care, adult care, and then community care. We can sort of ignore community care because it's such a small aggregate amount of time. So the big action is in this panel D and E. So we see that for most of the countries, except for Korea, the child care is actually going to become easier to supply. So those children who are such large consumers of care, there are going to be fewer of them. So it's going to be easier to supply that same sort of per capita level, given a changing age structure. Adult care, as we would imagine for population aging, is a different story. It's going to be harder to maintain that level of care consumption in the future. So just to review really quickly, unpaid care work is a large part of total work effort, done mostly by women, even at older ages, consumed at the greatest levels by children. And we also really find that at least on the total care economy, there's no evidence of large increases in unpaid care consumption at the oldest ages. But this also needs to be sort of reconfirmed with better measurement tools. Care demand and supply over all the different types of care stay generally in balance, but we'll have less child care consumption, more elder care consumption. So how can the care economy adapt over time in the context of these population changes? First of all, I think countries should support more time use data collection so that they can understand their care economies. It's the best tool we have for understanding unpaid care work. And then supporting healthy aging. I mean, that's good for a zillion reasons, but it's good because we need older persons to keep being able to supply that level of care that makes the worry about a care crisis sort of less intense. And then the other panelists will probably have a lot more to say about this, but I think all countries have an opportunity here to improve the quality of care jobs, both paid and unpaid. And I've gone over time, so I'll just leave the rest to the other panelists. Thank you very much.
Thank you very much, Gretchen, for that really interesting presentation to set the stage for our panel discussion. I'm Joseph Eglich. I'm the Deputy Chief Economist with ADB's Economic Research and Development Impact Department, and I'll be moderating today's panel discussion. With us today, we've got three panelists. Katja Freiwald, Regional Lead for Women's Economic Empowerment and Migration, UN Women Asia Pacific. My colleague Hema Swaminathan, Senior Economist for Gender, Economic Research and Development Impact Department here in ADB. And also my colleague Meredith Wyse, Senior Social Development Specialist, Human and Social Development Sector Office in our sectors group at ADB. To kick things off, why don't I start with Hema? Could you give us just some of your thoughts on Gretchen's presentation, some of the things that really stood out for you, just as a way to kind of kickstart the discussion?
Thank you very much, Joe. And thank you, Gretchen. What a fascinating presentation. And it's such an innovative use also of time use data. And a very intriguing conclusion. And I'm sure we're going to have a great discussion on it. What really stood out to me, and I kind of want to summarize a few thoughts from your presentation, is that when we talk about there not being a care crisis, I think your presentation really highlights the role of equity in terms of thinking about gender roles, who's providing the care, who's receiving the care, particularly as people get older, the sustainability of this care provision. Because as you rightly point out, the fact that there is no care crisis is really riding on the backbone of women being able to supply this care in an uninterrupted fashion over a period of time, right? So what does this really mean with changing aspirations? You have that in your paper, but sort of didn't come through in the presentation, right? And so when we also think about gender roles, what will it take? Will it take for men to step up into these caregiving roles? I think to me, it also highlights the point that there is time poverty, right? So even if we say that there is no care crisis, if we start thinking about the concept of time poverty and women's double work burden, how does this play out for women? And the fact, do they have the agency for choosing the kinds of work they want to do? And also, do they have time for recharging, leisure, and self-care? That aspect, I think, is something that we should reflect on. And finally, from a data point of view, I think as someone who is very interested in time use surveys, I think this is, again, a strong call for standardization and harmonization of how time use data is collected, right? You have very different countries, very different sort of data collection protocols, and they could influence the result, right? So these are just some quick, I think, highlights from the presentation that stood out from me. And I have a couple of quick questions which you could answer if probably you've already thought about these. One is about a detailed analysis of unpacking the paid work, the paid work that you talk about, market work, whether that's formal and whether that's informal, and how that sort of correlates with the provision of informal caregiving. Whether there is, I would suspect that there is a strong correlation, and I think it could be important from a policy nuance point of view. Changing age structure, we've looked at it across countries, but would it be possible to do a deep dive into a country that has collected time use data for a very long period of time? Japan comes to mind, I think, which has time use data since 1976, and use it as a panel to see how the age structure has changed and how the UCW patterns are also changing. Would there be a way to factor in institutional frameworks? Different welfare regimes, different workplace policies, different inheritance and property regimes, all of which could affect how care is perceived and how care is produced. And finally, as a thought experiment, what if there is an exogenous shock to the system like COVID? I notice all the data was pre-COVID. How might this change? Because I think one of the assumptions when you do your projections is that we are talking about similar levels of morbidity and mortality, right? And care consumption that would be required. So, just to say that I really love the presentation and I have a lot more questions, but I'll stop here for now. Thank you.
Great. Thank you, Hema. And yeah, some interesting points that you raised, particularly the question of how, thoughts on how COVID might have impacted some of these trends. Why don't I turn it back to Gretchen just for some quick reactions, and then we'll open it up to the panel. Gretchen?
Thank you. So yeah, all of the time use studies that, that work was based on and were sort of pre-COVID. And for some of the things that we've done, we even like ignore the COVID period because it was so different. However, I mean, I've kind of been trying to keep up with the literature of people who, produced by people who are looking specifically what happened to these gendered arrangements in COVID. And generally, there was a lot of sort of gender retrenchment that because in so many countries, the paid care economy just disappeared overnight. Kids were back at home, and the sort of school's role as a paid caregiver went away. So where childcare is concerned, there was a lot more sort of gendering and increasing the gender differences. We didn't see people sharing childcare, the increased childcare burden more equitably. We, in most countries that have had a survey where they could look at this, we've seen those burdens sort of double down on gender segregation. And now the question is sort of how sustainable is that? Was it a blip? Or is that sort of going to be the new kind of baseline that we're starting from? And as far as I've seen, that's different in different countries, but it is, almost like an employment shock when everyone's starting wage goes down, you then very slowly have to creep back up again. So it's going to take a long time to get back to where we were pre-COVID with many of those arrangements. The question on, or the sort of issue about the vulnerability of sort of women who are doing this kind of caregiving work. So there's a large literature showing that doing unpaid care work is stressful. It can hurt your own financial situation. It can affect your own well-being physically, mentally. So people doing that kind of work do have significant vulnerabilities. What I think I see from our data is that the scale of the problem is such that it's manageable. It's not so huge that it's going to require doubling social protection investments in order to really protect the people who are sort of being affected by this. But we also know from other research that the most intensive periods of caregiving, the most physical kinds of caregiving, that those are places where we can target resources. And I would say that, certainly we want men to step up on the day-to-day stuff, but for these periods of intensive physical caregiving, this seems like the more optimal solution is to offer more paid care sort of substitutes, more chances to combine unpaid caregiving with a paid caregiver. That would sort of, and that the scale of the problem is such that sort of a reasonable resource investment in this area could really do a lot of good and really make an impact on the people who end up with having to manage these intense periods of caregiving demand. Certainly, there's a big issue of changing aspirations. That current data show us that older women are doing a lot of unpaid caregiving, but the older women of 50 years hence, they have had different life courses, different expectations. That is going to be a big issue. And also family structures are changing a lot in many places as well. So if we're counting on spouses to take care of each other and there's been an increase in divorce, then those links, those caregiving links are going to be more tenuous. So that's certainly something we could look at more in detail. But in the whole National Transfer Accounts Network, there are a lot of groups that are trying to understand how different welfare regimes affect caregiving. There are definitely patterns in socialist or former communist countries that have impacted the care economy that sort of are maintained, and different welfare regime impacts. One that was just something that came across the off the top of my head, but and then the issues about sort of the time use data, is it really comparable across country? And Hema, as you mentioned, the best thing we can do about that is try and work on getting a more standardized sort of module. And the ILO and the United Nations are definitely working on trying to develop those tools to increase comparability. It's never going to be the same as a consumption survey, because what you do with your time or how you answer a question about time is harder than how many rupees did you make last week. So there are always going to be sort of more cultural issues in how people respond to those questions, but it's something that a lot of players in that space are sort of working to improve. So there's a lot of reason to stay tuned.
Great, thanks, Gretchen. That sounds like a really rich research agenda that you've outlined, as well as a data collection agenda. And it also strikes me that the more that this issue is spotlighted, the more consistency across countries that you can get in terms of the data collection, simply because more researchers will be using it, more learning across boundaries as well. Let me turn back to Hema to start the discussion. Hema, in Asia, informal caregiving is still predominantly provided by women. What do you think government and policymakers can do to support women to ease gender inequality and unpaid paid work? So what sort of policy responses might be feasible in this space?
Thank you, Joe, and thank you, Gretchen, for responding to those questions. Yes, I think, yes, certainly. I would say that one would be, of course, workforce policies. And I think we see a lot of movement already in the area of, when you think of informal caregiving and childcare, right? I mean, the concept of motherhood penalty and child penalty, at least, is now being increasingly well understood, and there's a lot of evidence for it. So part of it would be through supporting workforce policies. People tend to talk a lot about maternity leave, but at the same time, paternity leave is not as well prioritized. And the fact that it ought to be mandatory. Maternity leave also in the formal sector, the government has to provide incentives to the private sector by sort of co-funding these programs. It can't just be left to employers themselves to do the right thing. And also lots of smaller scale employers do not have the kind of cash flow resources. Transitioning back to the workforce, how to give women the skills to re-enter the workforce, how to ensure that workforces are ready to take on women who've had a career break. So this is really to think through some of the workforce policies, but can we think about the same for when women have come back into the workforce and boom, there's now an elderly care a situation that has arisen? Can I apply for leave saying I need to take care of an elderly relative, right? What are the policies again in place? So can we give the same kinds of importance that we do to childcare? But in some of these countries that Gretchen has chosen for this, or in developing Asia, the formal sector is relatively small, right? So when we talk about workforce policies, we are, of course, then leaving out a very, very large proportion of women who are very vulnerable by the fact they're already in the informal sector, which is largely unregulated, right? And so there, I think the state has a very direct role to play through subsidizing care, childcare, subsidizing elder care, either through a highly skilled employment program, right? Through the paid care economy that is both affordable, accessible, and quality. Often you do have childcare programs in informal to support women in the informal work sector, but the quality is so poor that people are still scrambling around trying to find grandmothers and grandaunts to take care of the children, right? So I think stepping up the quality of childcare or any kind of care that's provided by the government becomes quite important. And finally, I would, two more points, and I'll try to be quick. One is strengthen social infrastructure. There is a deep relationship between indirect care and direct care. The presentation here focused only on direct care. But when we are thinking about time, right, it's also provisioning of indirect care and how much time does that take? And how can you strengthen the social infrastructure to ensure that the time you spend on indirect care is public transportation, affordable commuting patterns, or if you're trying to source water, fuel, and labor-saving technology that is affordable for poorer households, right? So the relationship between indirect and direct care. And the final point I want to make is to go back to social norms, right? I think that in this day and age of social media and and information campaigns, really elevates the importance of the unpaid care work. And I think have conversations about its importance, making it visible, ensure that you have conversations about mothers being okay to return to the workplace, and the fact that fathers have a very important role to play in the care economy, right? You have DHS surveys that still show attitudes haven't really progressed. Men are wanting women to do the housework. There are world value surveys which show that people think that a woman is better off taking care of her children rather than entering the workforce. So how do we change those conversations?
Thank you very much, Hema. And of course, the cultural issues are both important and change very slowly. And it's often not a linear change as we see cyclical changes moving back in time. But let me turn quickly to Katja, so we can also get the views from UN Women. What policies and practices are you seeing that have been in place in the region, particularly supporting women working in the care economy? Katja?
Thank you very much. And thank you, Gretchen and Hema, for setting the scene so well. Hema, you have elaborated on a lot of things that I wanted to share as well. So I'm just going to switch and bring some other dimensions to the conversation, which might be really interesting. And Gretchen, I was really intrigued by your presentation, and I think it's important that we look at this data. I think I just want to take a view on bringing the lens on gender equality and care together again as UN Women. I think it's an important element, and also Hema mentioned that. But I think it's messages like the care emergency is not there, or we won't see an increase in care needs across the region. I think it's good that we see that and that we have data, but I think it's also important to look on where we are currently in the care economy. And I think really being very cautious about that spectrum from unpaid care work to paid care work. And I think your graphs actually on showing how big the part of unpaid care work is I think something which we need to address and policymakers need to address, and different type of stakeholders need to address, because if we don't shift that, I think we will continue actually producing root causes of things like why are fertility rates going down. There are reasons for that, and I think we need to make sure that we don't disconnect these conversations. So I think we can not only look at data for care without looking at the gender lens to that. So I just wanted to bring this up front. And what we have been seeing, and unfortunately we have less data in the elderly care and the aging society data, but if we look, for example, women that have children in preschool ages, 65% of them, if they don't have children, are in the workforce, and that decreases rapidly to more than 40 only if they have children in preschool ages. So I think we need to look also at data that really keeps women out of the workplaces. And that's why I think a life cycle approach to care and the impact on women is really important when we speak about care. So that's the first thing. The second area, I think the moment we move into the paid sector, and I think that's something what we advocate as UN Women for, is recognizing care, valuing care, unpaid or paid, but also seeing that that shift is happening, that care is remunerated, so that it's paid for, no matter where it's provided, in home or in institutions. But we need to make sure that it's value and that there is that it's paid for. And I think what we have been seeing in Hema, I'm glad you mentioned the role of the private sector as well. Over the past 3 years, UN Women has been working a lot with innovative care delivery models. Including entrepreneurship models where smaller kind of enterprises provide care, which supported and contributed to closing the care supply and care demand gap. However, I think one of the things we've also seen in the absence of public regulations and policies that are still in our region. So we still see that there is a gap of regulations. We see increasing policy, parental leave, maternity leave, but I think a whole spectrum on the life cycle approach to care, I think there's still a vacuum in policies. And what we see happening, and I think the digital transformation is one example on how we see that actually new solutions come into the care economy and are very often unregulated and can pose issues to the decent work of care workers and also to the quality of care that is provided and affordability. So let me give you one example, and then we can move maybe on with the conversation. But digital labor platforms, I think it's a very hot topic in Asia and the Pacific. And we have been seeing the rise of these in the care economy. And so imagine this, envision this as the Uber or the Grab, if you're here in the region, of the care economy, where there are care givers, you have customers that are demanding the care work, and it's a matchmaking platform, just visualizing this. So we have recently done some research and looked into, can care digital labor platforms in the care economy contribute to more formalization, to move from informality into formality? Can it provide better, decent work for care workers? And we have found very interesting finding, and I'll share the research in the chat in a second. But we have seen that the care economy, and that's my message here, is so informal that every element to formalization can contribute on creating more decent work or better conditions. So what we have seen on surveying some of these care workers on these platforms, they really highly mentioned that they have increased feelings of safety. They have contracts or agreements in place. They are paid regularly. And I'm not saying that it's in general right for everyone. It's for the enterprises that we have researched. But I do think that we need to look, if we think about care supply and demands in the regions, to connect it to women's economic empowerment, but also connect it to decent work provision in the care economy. So I'll stop here and can share a little bit more maybe later.
Thank you very much, Katja, and particularly those points on some of the innovations in this area. Quite interesting, and looking forward to seeing that report, which my colleague Mel will be sharing with the audience. Let me turn now to our final panelist, Meredith. I've also got a question here that'll sort of mix in with the question to you. So first, how do we develop a community long-term care system to support informal caregivers? But also, I have a question here from Natasha Kim about, what are some of the ADB programs? So maybe if you could give us some examples of ADB programs looking at unpaid care work as well as part of your response. Meredith?
Okay, thank you so much, Joseph, and thanks for the questions. So I'll be talking more about the direct care for provision of older adults and some of the sort of lessons that ADB's been learning over the last few years in terms of this work. So we have been, over the last few years, we've really been focusing on trying to understand what a good home and community care model to support older adults and their informal carers would be, and we've been working in a number of countries on this. And I think the first thing that needed to be done is to actually recognise that whilst there is family care, there is also a need for formal or building up home and community care services, because often you still hear there's this dichotomy that there's family care, therefore no other support is required. But as has been highlighted, by Gretchen, you know, there can be very intense periods of care, especially for elder care. So some of the key sort of tools and processes that we've been using is actually trying to work out who does need care and support in the communities, with sort of very, very clear tools that really screen all older adults and actually interview their caregivers as well, to really assess the situation of the caregivers in terms of their stress, financial situation, skills and confidence in providing care. Then really building up community care hubs, which are there to really coordinate all the resources of the community, from local authorities, private sector, the community organisations, to be able to coordinate this care and provide services such as home care in the home, information and referrals, and active ageing services, all brought together in a case management system. So how does this actually help the informal caregivers? Obviously, there's a transfer of skills to the home care. The trained home care providers are transferring the skills to the family caregivers. We're seeing quite positive results in terms of linking up informal caregivers and their family members to sort of pensions or disability allowances that they were eligible for but hadn't recognised that. It provides the informal caregivers with a break, and it builds up that network of support. And just to reflect on social norms, what we do find is often there's quite a lot of reluctance initially to accept any outside support in care for older adults, because it is seen as a family issue. But through this, the families are seeing the value of the support, and it is changing that social norm. But what we do find is there's still a range of services that are required to really support informal caregivers. And so we have an exciting new project in Tonga, which includes one output specifically on introducing these services to support home and community care and the informal caregivers. So this includes a caregiver allowance, access and discounted access to supplies for caregiving, the assistive technology, and really building home modifications and a training program for caregivers. And we'll be evaluating that program over the next few years. But some of the lessons from this, even with this support, there's still a very heavy reliance on the family caregivers, with many family caregivers still having to reduce or come out of the workforce for periods of time. So I really echo the comments about, you know, activities or programs to support family caregivers to re-enter the workforce and looking at sort of extending social protection policies for them. The other thing that we really see at the community level in this work is actually, you know, there's often people who are high risk. It's when the family care has broken down through the stresses and strains of this, and actually earlier intervention and coming in and supporting those families earlier on would actually maybe prevent some of that care breakdown. I'll stop there, Joseph, for a minute. Yeah.
Okay. All right. Thank you, Meredith. We have quite a few questions coming in from the audience. I'm looking at this question here by Hok Cheong. Can you please share how countries in Asia are enabling investments in the care economy? Maybe I could ask Katja, do you have some insights onto how some of the countries are doing? And I note that Hok Cheong has also provided a link to a Malaysian study that people maybe find interesting. Katja?
Great. I'm going to come into this, and I might actually ask Mel to share my slides that I had, because the question actually, we looked into that as well and anticipated some on the investment questions, and maybe take it a little bit broader, if that's okay. So I just want to say that investments need to be from different means, and I think we've heard this before. So public investments in either world, of course, care is a universal right and should be financed by governments, and that's what we're strongly advocating for. The reality is that we have been seeing different models evolving, and it needs because the investment gap is just so big. So I think in terms of really catalyzing such investments, I think it's important that there is an aligned agenda to what we invest into. And maybe just a reference here, the UN system came together last year to create a paper paper, which is called Transforming Care Systems. It's a guidance for governments as well as a first space and giving policy recommendations for different types of care across the life cycle where investments are needed. So this is one thing. The second one, I think what UN Women has been seeing, we can stay on the first slide, please. And ADB has been very much involved in some of that thinking as well. Is last year we brought together the region here in Asia and the Pacific in Bangkok at the second Asia Pacific Care Forum, where we really discussed what type of investments are needed and from whom. And as a result of that, we launched an initiative, and I'll invite you to QR the code here and look into what that is. But we launched a Transform Care Investment Initiative, basically a vehicle on how to bring finance or catalyze finance to implement the recommendations out of the Transforming Care Systems paper, but particularly for the region. So I think this is a very interesting approach, and look into this, which really looks into the role of public finance, looks into blended finance models. We are currently exploring on how to create partnerships to actually finance or channel more investments into the care economy. And maybe what's interesting to do this, maybe Mel, if you go 2 slides further, just want to point you also to, in the interest of time, to a very interesting tool, the next one, which is called the Care Policy Investment Simulator. And I think the first decision very often for governments to make actually the choice for investments in care, be it infrastructure, be it in the training of care workers, is that very often the conversation is it's a cost to the system. And I think this is something what we're trying to change. So that simulator actually helps you by inputting different type of policies as well for aged care, but also child care. What is the return on investment for your specific country? So what we have done with this number here is we looked at 10 countries in the region, Asia Pacific, under the Transform Care Investment Initiative, and did a calculation with some assumptions to that, which really came in really kind of a conservative scenario. So it's not even the best scenario, which would really come to investing $1, returning more than $3.80 as GDP growth. So I think it's interesting to have these simulation tools for governments as a decision-making tool. So I'll really invite you to look at that. And last but not least, on the next slide, I just want to say, in order to get the right investments into the care economy, we need to embrace different approaches. We have spoken a lot on the life cycle approach. I think an important one, particularly for the investment case, is a whole of society approach. I think Hema mentioned the subsidies. We see that employers are stepping up. We see that new delivery models come there, but if they are not subsidized, we fall into the risk of making care not affordable and accessible for everyone anymore. And last but not least, I would say the gender transformation needs to be part of any transformative investment decision. And to close it up, and I think as an invitation on the last slide, be part as a community. We are not having these conversations only here. I think these conversations are for the moment ongoing at different levels. And one global conversation to invite you to is the Global Alliance for Care, where a lot of these investments conversations are currently happening. So I think that gives you maybe some tools or some initiatives to point to in the interest of time. Thank you very much, Joseph.
Thank you, Katja. So we're close to the end of the seminar, but I wanted to give everyone a chance to sort of give a final thought. But I have a particular issue that I'm interested in, something that had come out of our Asian Development Policy Report that we launched last May on aging well in Asia, was this idea that keeping elders engaged in activities longer is better for their mental and physical health. So can we think of ways, a more positive idea if we've got this aging society? Are there mechanisms for engaging with elders for longer, particularly to help balance some of the unpaid care work? Why don't I start with Gretchen on this, on your thoughts on this?
Yeah, there's definitely a lot of opportunities to do this a little better. And I think it comes down to, in some ways, the world of work doesn't work for the populations that we have now. So, allowing older persons to be engaged in market labor for longer periods of time requires changing a lot of that market labor. But it could both help with a workforce squeeze in the future and also help with well-being, but it requires making sure that those work opportunities work for older persons. So it really, our idea of work has to change, but I think it's a great opportunity.
Thanks, Gretchen. Katja, your thoughts on a more positive way of thinking about the challenge in the future, how we can maybe rethink it to the benefit of improved unpaid care work in other aspects of life?
I think if we really embrace this life cycle approach, I think it will be a great win if we get women particularly part of the workforce along their life cycle. I think that's a really untapped opportunity if we can frame an environment or create that environment what Gretchen described, and making sure that women can be part of that at any time in their life and have choices to opt for that.
Thank you. Meredith, your thoughts on how we can engage with elders better to provide unpaid care more generally?
I would like to highlight that in many countries, specifically in Asia, there's a whole range of older people's associations or intergenerational associations, which are really community-based organizations that, you know, are looking at keeping people engaged, healthy aging, providing some care, you know, and these are really, really powerful, not only for those points, but bringing, you know, overcoming issues of loneliness and feeling like there's no contribution to society. So I would encourage everyone really to sort of link up to those associations, which are in many countries in the Asia region and are forced to be reckoned with. Thank you.
Thank you, Meredith. And Hema, to you for the final word.
Thank you, Joe. I'll echo what Meredith says. I think in terms of sort of tapping into these associations, but also I think tapping into the experience that older people have. They have a rich wealth of experience of men and women, and tapping into that in building the community care model. So they also feel productive, and there is a huge learning opportunity for everyone.
Thank you all. And thank you to Gretchen for your presentation, Silvia for opening the session, and to our panelists, Hema, Katja, and Meredith, for a really interesting discussion. Unfortunately, we don't have time to get all of the questions, but I do encourage you all to download our Asian Development Policy Report, Aging Well in Asia, of which this discussion that informed this webinar today is included as part of the chapter. And also before we close today's webinars, I'd like to invite you to join our next Asian Impact webinar on how to become an entrepreneur, which will be on 19th February, 10 to 11 a.m. Manila time via Zoom. So please do join us for the next event. Thank you all for joining us today. Have a great rest of your day.